Very nice.
Hello, good morning to you, and many thanks for joining us. You're watching Galaxy Today, coming to you from Galaxy Television. It is the Health Edition. My name is Justin Academy, and of course, I'm not alone on the show this morning.
Of course, I am Kelly. Giga, it's good to be back on the show this morning. Morning Lagos and morning Nigeria.
All right, today on the show, we'll be looking at something that almost everyone can relate with when we talk about public health. That's about hygiene and prevention of communicable diseases. Kelly, you will agree with me that hygiene is something that we should actually hammer on, because a lot of people actually take that for granted most of the times.
Yeah, absolutely. It's a big issue. It's a massive issue. It's just rather disappointing that we don't get to lay emphasis on it as we should as a country, except maybe there's an outbreak or something. I mean, it's not the killings in Zamfara or the bandits or the Boko Haram issues, but then we cannot take for granted the fact that hygiene is something that we should pay attention to as a government and as a nation.
Yes, we should really do that. And in keeping with that, the Lagos State Ministry of Health, since Sunday, the World Health Day, have been going on about various media stations, enlightening and educating the people on what they need to do concerning their health and, of course, personal hygiene. And today they are here joining us in our Lagos studio to talk about that particular issue. It is an all-week exercise for them, and we have one of their officers this morning. Let's make welcome yesterday Olayinka Agbola. She is a senior education officer with the Lagos State Ministry of Health. Many thanks for joining us yesterday.
Thank you very much. It's great to be here.
You're welcome.
Thank you. Good morning.
Okay, let's start with the fact that a lack of education probably is the reason why we are having some of the issues that we are having. But how much progress have you made so far, has the ministry made so far in terms of education?
Well, the Lagos State Ministry of Health has been very key in trying to educate the general public about different health practices that can not just fight diseases when they get them, but to prevent diseases. The ministry works with we have a lot of health educators in our system working in areas of disease control and disease prevention. If you look at every local government area in Lagos State is covered with at least a number of health educators. They work in the wards, they work in the primary healthcare centers, they're the local governments, going to schools, CDAs and all of that, just trying to talk and inform our people more about different health practices. And you talked about hygiene. Hygiene is what we have found that is very key in preventing a lot of communicable diseases. And communicable diseases are the diseases that can be, transmitted from person to person, usually through, it's either a virus or a bacteria or fungi, and it's very easily communicated. So one of the ways we preach a lot of hand washing. Even in our schools, we have a push for teaching children how to hand wash. We give out handbills, posters and all that, showing children step by step how to wash their hands, because we realize that, people, before they eat, you don't remember to wash your hands. There's sometimes the critical times before you eat, once you have used the toilets, when you go out and you come back inside, because your hands, you get in touch with millions and millions of bacteria and viruses throughout the day. I'm sitting here, if I touch this chair, there are viruses and bacteria on it. But if you are washing your hands, and you're keeping your environment clean, that's also another thing. How we are people.
Okay.
We're not so...
Yeah, well, would you say that the ministry has done enough? Has the government done enough? We still get to hear sayings such as, I'm an African man. I mean, this can't happen to me.
We continue to, the ministry is doing a lot. Lagos State government is doing a lot in fighting it. I mean, we're a state of, officially we're 22 million people, but we know that number changes because people are coming into the state every day. So every day we're working harder and harder to push for more hygienic practices amongst our people. We cannot do it alone. We also, have partners, which are, professional partners, and as well as, the public. So that's why we come on shows like this, to talk and educate more and give a little more enlightenment.
Okay, yesterday we'll come back to you, but let's quickly join Ibadan right now and bring them into this particular discourse. Joining us from the University College Hospital Ibadan is a Chief Nursing Officer, Oyerunke Bello. Many thanks for joining us on Galaxy today as we look at this issue of preventing communicable diseases through hygiene. Let's talk about personal hygiene for starters. A lot of people don't really know what it entails when we talk about personal hygiene. How far can you go to be conscious of your hygiene, specifically on the home front? All right, we'll try and reconnect with the Chief Nursing Officer at the UCH Ibadan. Let's stay with Lagos for a bit. Yesterday, I think I should direct that same question to you. Personal hygiene. A lot of people don't really know how far they could go. You talked about hand washing, but what else do we need to be very conscious of?
When we're, for example, when you're cooking in the kitchen, we're cutting meat, we're cutting fish, and we tend to just leave those surfaces the way they are. It's always a good idea to wipe down the surfaces. Soap and water go a very long way in maintaining personal hygiene in the kitchen. And then even just around the house, dusting, when you clean your floors, use soap, water, and a bit of bleach, because bleach can help a lot in killing viruses and bacteria. And it's just a matter of not feeling like when you sneeze, a lot of times when a lot of us cough or we sneeze, we cough into our hands. We really recommend that you cough into your elbow, because with that you're covering your mouth.
I would like you to say that again and probably demonstrate.
Demonstrate. So
Nigerians can see, because I'm just hearing this for the very first time.
So usually people cough, they cough.
Okay.
Right? When you do that, you are putting the viruses and the bacteria in your hands. You're going to take that hand and shake.
Yeah, we shake a lot
else.
in Nigeria,
you're going to
actually.
Open a door. You're going to touch the chair and touch other surfaces. That is how we actually spread the flu and cold and all of that. But now, if you cough into your elbow.
Your elbows. It's like
no, not
dapping,
but into the elbow. No, you're not dapping. You're coughing into the elbow. When you cough into your elbow, you sneeze and you sneeze into. If you don't have a tissue or a handkerchief, you cough into your elbow. With that, you're keeping it from spreading, because you're not just coughing out into the air, and then you're covering it up. And it doesn't have to be on your hands, because you're not using your elbow to touch other surfaces.
If we take a closer look at what you've just explained now, and the fact that we have pores, so won't the bacteria probably penetrate?
But it's coming from your body.
Okay.
So how's it going to penetrate back? It's already in your body.
Okay.
You understand? You're not coughing into another person's hand. You're coughing into your own elbow. So it's not penetrating. It's not penetrating somebody else.
Okay, all right.
It's just to help to prevent the spread.
The spread of it. Okay, we'll give you a bit of a demonstration on how to go about hand washing. But feel free to interact with us using our social. All right, welcome back. It is still Galaxy today. That was a demonstration on hand washing. So basically, it's not just about going to the toilet or going to a place where there is water and just do the whole stuff like that. There's a process, right?
There's a process, and that video showed us step by step, how to go about hand washing, and it's very critical. We found that really helps us to curb the spread of diseases.
But it's just about any detergent or any soap. What exactly can you use?
You can use. There are a lot of in the market now. There are a lot of hand soaps in the market, but also even just your regular bar soap that you use, your bathing soap, just wet your hands, put the soap in and lather, and it's the lathering action of the soap that helps to take off.
I think I must call our attention to the fact that I think hand washing became probably very popular when there was an outbreak. I think of the Ebola virus. Must we always get to wait for an outbreak before we get to do the right thing?
Do you know that in 2009, the Lagos State government actually keyed into a WASH initiative, which was a water sanitation and health. Okay, so you know about it. This is something that we were doing. Ebola didn't come till 2014. So the Lagos State government has actually been pushing hand washing for years. before that Ebola outbreak happened. Although what happened with Ebola, and just as a people, we like to, it's when we have, you know, big epidemics or when there's some type of calamity that everybody now keys into it. People might have been seeing it. It's been on the radios, you know, there are PSAs, there are jingles, they're all over the place. But people, you know how you don't pay attention to something until you feel like it now pertains to you. When people now became scared of contracting something that was a life-threatening disease, then we now all started keying into it. That's when you now started seeing a lot of hand washing stations. Even you go out to places and you find the hand sanitizers that people use more of now.
Now, I think there have been calls for the Lagos State government to probably bring back or restore the monthly sanitation, I think a day in the month where people get to clean up and all of that. Do you think that with that, if we go back or if we revert, we will probably make some progress in terms of the environment and cleanups and all of that?
You know, I mean, currently the Lagos State government has, through the Ministry of Environment, works in trying to sanitize the environment. But I think in answer to your question, when it comes to the monthly sanitation exercise, the government, I'm sure, is looking into how to most effectively, you know, make that happen, because it's not just about that one day in the month to clean. You see, our people now wait till that last Saturday in the month to clean. What happens to the other days of the month? What are you doing in your own personal space without being mandated to keep your environment clean? You can't just wait till the end of the month to sanitize not just your house and your environment.
Exactly.
Why not make it a weekly affair, a daily affair? You know, things like, let us stop throwing trash on the floor. You know, you walk, people use pure water, and as they finish it, they throw it on the floor. You eat with a pack and you throw it on the floor. Those are things that make our environment dirty and actually cause, you know, a lot of diseases for us. And they block our drainages. When it rains, then you will now have flooding. Flooding also brings its own, you know, set of diseases and issues, health issues that can occur from that. So I think it's more of a personal mandate, each of us to ourselves, saying that I will keep my environment clean. I will not litter. I will make sure that I'm cleaning. I don't, you ask some people that throw things on the floor, throw bottles on the floor outside. Would they do that in their own homes?
Okay, let's talk about, you talked about wash. Let's stay on that for a bit, and that's on water and sanitation health. You notice that some people still don't have access to potable water to drink, you know, and there's been this increasing rate of typhoid in most of the hinterlands, even in Lagos here. Let's talk about personal hygiene, specifically when it has to do with water. Just what do we need to be very conscious of?
So, you know, back in the day, we used to boil our water. We would boil and filter. Most houses had some form of water filtration. You know, you would get the water from the tap or from the stream or whatever. You would boil it, leave it to settle down, and then they would, you know, filter it. Some people with, you know, a cloth. You had those candle filters and all that. We don't do a lot of that anymore because of the advent of, you know, the sachet waters and the bottled waters and all that. And we assume that all these waters are clean. You want to be very conscious of the source of your water, you know. So even though you are buying packaged water, you want to be sure that the source is good. Otherwise, you know, why not go back to boiling and filtering your water so that you're sure of the quality of the water that you're taking in. Again, you see, sometimes it's not just about what you're drinking. If your hands are dirty, you use the toilet, you didn't wash your hands, then you went to eat, and then you sat down and you took a bottle of water. Even if that water is clean, you are transferring, you know, bacteria and viruses to yourself. You're actually infecting yourself and infecting others. Or the person who's handling your water has dirty hands. Their hands are dirty. They cough. They have a cough and they coughed and all that. Or they had typhoid and they coughed. And now they're handling your water. They're giving you. They're the ones carrying the sachet water to you. They're selling the bottled water to you. Their hands are dirty. They're giving you. You take that. You open it. What have you done? And you drink it. So even if the water is clean, the handling is also a key issue, which is why we really, really push this hand washing.
But, okay.
All right, feel free to interact with us on social media using the hashtag Galaxy Today. You can also make contributions. You can also ask questions if you have. Just use the number on the screen. Don't call, but do send us SMS. We'll go straight to Ekiti State. We have Senior Registrar ONG Federal Teaching Hospital from Ekiti State, Dr. Ayorinde Olowokere. Many thanks for joining us on Galaxy today. We're looking at prevention of communicable diseases through hygiene. I want us to talk about diarrhea. It's one of diseases that most people, contract easily in this part of the country. So what advice can you give us specifically when we talk about diarrhea, specifically when we need to take care of our hygiene? What specifics should we be looking at?
There are many of them, and most of them are diseases that could be passed from one individual to the other, to put it in a simple term that everyone. And measures to prevent communicable diseases start from our environment. We need to clean environment, cut our bushes, ensure there are no grasses if possible, ensure we have effective and clean water disposal. Drainage system should be prompt and proper. We need to have a good source of potable water, and our refuse disposal system should be also rules and standards available in sanitation. Also, coming to ourselves, our personal selves, we need to ensure that we live in an environment that's void of overcrowding. Also, we need to be wary of the aeration in our environment. Proper ventilation in our environment will go a long way in preventing communicable diseases, as many of these diseases are airborne or through contact or through when you share towels, handkerchiefs, bedspreads with infected individuals. For instance, measles is an example, viral infections are examples, chickenpox, pulmonary tuberculosis, and many other diseases. So if we have good ventilation system in our environment, it will help us allow these diseases to go into the air and get lost in the air. And also, we need to bathe regularly. We need to ensure our own personal hygiene is taken into is taken as a very important aspect of our bathing and septic. So are here, and we need regular hand washing. Regular hand washing is a very, very important point, most especially in the environment. We in the hospital, we ensure regular hand washing for the at home, in our places of work, in our places of worship, and in other aspects, or in other aspects of the community. We need to imbibe a culture of regular hand washing. There's some techniques that you can wash your hand, but I don't want to bother us with all those techniques. But at least you should make sure that after contact with suspected individuals or with anyone, when you go to the office before you go home, you wash your hand, and when you are getting home, before you touch, you wash. Before you handle some sensitive things in your home, you wash your hand. That's, for instance, health workers, we have a suit. We call it a lab suit. It's to prevent us carrying infection from our facility to different rooms. So we need to imbibe this culture of maintain a high standard of hygiene, and we need to have it at the back of our mind, in our subconscious, that we are world filled with communicable
Right,
diseases.
it is still Galaxy today, and we are still talking about hygiene and prevention of communicable diseases. We just had Dr. Ayorinde Olowokere. He is a senior registrar O&G Federal Teaching Hospital, Ekiti State. We'll take a quick break. We'll still have yesterday Olayinka Agbola with us here in our Lagos studios, and we'll take your comment and questions, and if any, when we do return, stay with us. All Welcome back if you've just joined us. You're watching Galaxy Today, the Health Edition. We'll take a bit of a detour and join our correspondent in Imo State, where there was a report of a fire outbreak at the airport. And we'll just get some information before we continue with the discussion right now. Good morning to you, Ajibade. Many thanks for joining us on Galaxy Today. So far, what's the situation on ground at the Imo airport?
The situation at the moment is that normalcy has returned and all activities has commenced as promised by the airport authority. In there is the executive lounge that was affected by the inferno. As it is now, it has been open to operation. Earlier on, there's been arrival and most people who actually came.
I'm afraid would try and reconnect with you subsequently because we're having a bit of distortion from your end. Ajibade Awofeso is Chief Bureau from the Southeast, and he joined us to talk about the fire incident that happened at the Sam Mbakwe International Airport in Owerri. We still have yesterday Olayinka Agbola with us, Senior Health Education Officer with the Lagos State Ministry of Health. She will respond to some issues right now, but let's take this particular comment from one of our viewers. He says, I think that people should endeavor to keep their surroundings clean at all times, and we should also be conscious of what we eat or drink. Shego Fang Bigbe from Ondo State. He talked about what we eat and what we drink. A lot of people, a school of thought would say that before you take your fruits, you should actually wash it with water and salt. What's the essence of the salt, or must we use salt? I really don't, I need some clarification on that.
Well, the idea of using salt is that, salt can act as a way to help you get rid of the bacteria and viruses. We can't advise that you use soap because obviously soap is dangerous for you. But salt can be ingested. It's just a way. And you know what else salt does? It's an abrasive. So for example, if you take a mango, mangoes are in season, you put salt, water, it will be like a scrub. So you're scrubbing off as much of the dirt and bacteria on it as possible.
All right.
Okay. I was going to say that we get to use salt a lot in this part of the world. I remember when the Ebola virus, the outbreak, I remember that I think I was 7 then, and there was this call, please go take your bath with salt.
Yes, but remember that Lagos State government actually came out and advised against it because people were, too much salt can lead to levels of toxicity, which is dangerous too.
Okay, Ma, as we look at the issue of hygiene, Nigerians have been described as very happy people. Would you describe Nigerians as very clean people as well?
I think Nigerians have the ability to be very clean.
The ability.
The ability, but we're not.
To be very clean.
Okay.
But I think we take it for granted, and so we don't practice it, even though most of us know what to do to a certain degree, but we take it for granted. So I believe that Nigerians have the ability to be very clean. Nigeria has the ability to be a very clean country. Lagos is a place where people know, because we know these things. We know that we should wash our hands, keep our environment clean, all of that. It's just our job to remind our general public and to, inspire us to be our better selves.
Okay. Well, let's look at something else that has been giving a lot of people concern. It is still part of our health. It is something that has become worrisome, even for me. I want to find out the health implication of it all. Lots of people these days, even men sometimes, go about going out with umbrellas. Some people use a bit of a shawl to cover themselves, all because of the intensity of the heat right now. I don't know if it's a Lagos thing or just across Nigeria.
It's across.
It's
across. From reports, it's across.
Global warming is a real thing. It's been, we've noticed an incidence of higher temperatures all over the world. Lagos now, we're experiencing a heat wave, and so because of that, it's hot. You step outside and it feels like the sun wants to, cook you. So what we advise people to do is, try to wear light clothing. avoid excessive exposure to the sun. So try not to be in the sun too much. Things like, the umbrellas, the shawls help a lot to prevent, the sun going directly on you. Then we also advise that as much as possible, take as many cool showers as you can, because water has a cooling effect. So, you get home in the afternoon or something, or you're home, you're very hot, you pour some water on yourself, it will cool you down. Stay in a well-ventilated area. If you're indoors and maybe the windows are closed and shut, of course you're going to be more hot than if you were sitting, in a place that had the windows were open, the doors were open, so you're having cross ventilation. Then something that's very, very, very key is drinking lots and lots of water and avoiding caffeinated and alcoholic drinks, because those alcohol and caffeine, things like coffee and all of that, they actually dehydrate you. So they are taking water out of you. But when you drink a lot of water, generally we say for most adults, drink a minimum of 2 liters a day. If you can drink more than that, that's great.
2 liters.
2 liters of water.
2 liters a day. So we're talking 4 sachets of 4 packs of sachet water. We're talking the medium-sized bottled water, about 3, 4 of those. You understand what I mean? You drink a lot. Just keep drinking. Carry a container of water with you wherever you go, so that, because you find that, like, for many of us, you are going around, your throat is parched, and that way you can reduce your level of dehydration. Because what happens is, with this heat, a lot of people are dehydrated. When you are dehydrated, you can get, heat exhaustion. You are tired from the heat. Actually makes you tired, and then you can now have heat stroke, and which can eventually lead to death.
When you say heat stroke, what does that entail?
So when we're saying heat stroke, is the heat is so much that it causes your organs to actually go into a form of stroke, like shock.
Whoa.
Yes, and
So
it can be fatal if
the
not.
heat can actually cause that.
Yes, it can be fatal if it's not expressly addressed, like immediately. So what we're trying to do is prevent it. So drink lots of water, stay hydrated, keep cool, avoid coffee and alcohol,
Coffee.
Especially. Yes, in
Okay.
this time, because it's dehydrating. If you're going to drink coffee, make sure you're drinking a lot of water. But we just generally say avoid it and avoid alcohol. Alcohol is a very it's a culprit. It's a culprit.
Okay, I was going to ask, would you suggest that, or would you think that the population of Lagos also contributed to the level of heat here?
Well, to be honest, the heat is everywhere. Have you been to Kano or Kaduna recently? Or even Abuja? It's very hot. Yes, we have a pretty high population density, but we're a coastal area. We're surrounded by the lagoon on one side and the ocean on the other side. So it's more of the global warming is actually what is causing it. All over the world, they're seeing an increase in temperature, and this is quite a big concern.
Okay. All right. We'll come back to you, Doctor. We understand we're getting signals from Ibadan. Let's try once again. We have the Chief Nursing Officer standing by University College Hospital, Oyerunke Bello. Many thanks for standing by as we look at preventing communicable diseases and, of course, personal hygiene. Our guests in Lagos and, of course, in Ekiti have given some tips concerning what we need to do, specifically hand washing. What other tips would you say are critical for people to be conscious of?
Tonight's been air. Apparently, the major way to prevent many of these communicable diseases is through a multi-level approach. And so, since personal hygiene is a major thing here, but we'll also talk about food safety. Food safety, and here we'll be talking about keeping your food safe, covering your food at all times, making sure that you separate cooked and raw food, making sure that foods are properly kept and the environment is clean, preventing access of rodents and other agents or vectors from gaining access to our food material. Like I said, it's a lot. We have a lot of approaches to prevent communicable diseases. The ones that really affect us again is the vector control. That's preventing most of these vectors that are responsible for transmitting agents that are responsible for communicable diseases. Take for example, our environment must be kept very clean. Our environment, the bushes around us should be cut. We can prevent contact with some of these vectors by limiting access to them. If we're talking about malaria, for example, the use of insecticide-treated mosquito nets prevents us from getting in contact with infected mosquitoes that are capable of spreading malaria. On the part of the government, one of the things that can also, an approach that they can also use is through immunization and chemoprophylaxis. And immunization, you will see that this is being stepped up day by day to prevent some of these communicable diseases. We have talked a lot about hand washing, and I'm glad to hear from the senior officer from Lagos State Ministry of Health that even our target is to get our little children oriented about the importance of washing their hands regularly. This can also be done by creating lovely songs for them while they are practicing what we're teaching them, so that it stays with them and they do it regularly. We cannot overemphasize the availability of safe water. Safe water is very, very important, and so to prevent communicable diseases, government must also step up the effort to make available safe water for all. When we have access to safe water, we can talk about adequate hand washing. We can talk about using clean water to prepare our food.
Okay, as a chief nursing officer, I would like you to probably share with us your experiences, because you get to meet with Nigerians who probably who are going through or who have gone through some of these diseases. So just get to share with us some of your experiences. And of course, I would also like to find out the types of communicable diseases, if we do have.
Much. As a pediatric nurse, children are mostly affected with some communicable diseases. You get to see children with diarrhea day in, day out, all of the time. Some reporting very late with severe dehydration. And I would say that when they report late like that, it's usually difficult bringing them back. So that's why I said that particularly for our children, we cannot but lay emphasis on importance of personal hygiene for their parents in preventing transmission of these bacteria and viruses that are responsible for communicable diseases. It is important for parents to wash their hands very regularly when they are preparing feed or the food of our children. It is also important to let our children know the importance of washing their hands regularly before after visiting toilets, before eating, when you just come back from outside, and when you have touched railings around. They must also be taught that you can actually walk without rubbing your hand on the railings around.
Yes, Bello, before we let you go, one final question. Since you work with pediatrics, let's still talk about this issue of heat wave as they concern children. What would you advise right now with this hot weather being experienced across not just Nigeria, across the world? How would you advise parents, to do? What should they do specifically in taking care of their children in this hot weather?
Be proper ventilation. Let open all windows. There should be cross ventilation. Children can be advised to just put on light dresses. They can also take plenty water. I know some children don't like taking water directly like that, but we can provide for them. They can drink juices, oranges. Mango is available now. We can also get some liquid from there. You should also give them good nutrition. Let them eat well. Essentially, the weather is actually very hot, but essentially, we should let them be well hydrated. We should take particular notice of the quantity of water that they drink every day. Parents should also watch the color of the urine. It gives them a good signal when a child is dehydrated. When the color of their urine is turning yellowish, it sends a signal that that child is dehydrated, and so we should make effort to hydrate them. For our babies under 6 months, let's breastfeed them exclusively. So the mothers also have to be well hydrated to be able to breastfeed their babies exclusively. All this will help in rehydrating the children and making sure that they don't get dehydrated for the season.
All right, many thanks. We've been speaking with the Chief Nursing Officer, University College Hospital, Ibadan, Oyeronke Bello. Many thanks for joining us and sharing your thoughts on this issue with us. We do appreciate it. Yeah. We still have yesterday Olayinka Agbola here in our Lagos studios. You know, in our pre-chat before we came on air, we're talking about this heat wave and how a lot of people tend to use sunscreen. A lot of people have even improvised using methylated powder because of this heat. Just what would you advise?
So methylated powder is good, not as sunscreen. It's not created to be sunscreen. It's a methylated dusting powder is for rash because you know with the heat comes heat rash, especially when you are not wearing light clothing, your body is not well ventilated, and sometimes you see on children and even adults with heat rash. So what the methylated powder does is it helps to cool the body down a bit, and then the powder will soothe the rashes. It's not meant to be sunscreen. Okay. If you want to use sunscreen, there are creams that are made specifically for sun protection. So that is on another level. And sometimes even just, you know, using an umbrella. You see these days, a lot of people go around, a lot of ladies even have small umbrellas, portable ones in their handbags that they just wear when you step outside and you see it's very sunny. Because umbrellas are not just for the rain, they are also good for sun.
For the sun. All right.
Okay, I think you also talked about the fact that people should take chilled water or cold water and all of that. But we find ourselves in a dispensation.
I didn't say cold water.
Any water?
Water.
Okay.
It doesn't have to be. It doesn't have to be cold. It doesn't necessarily have to be refrigerated water. Any kind of water, ordinary water will do.
Yeah, because I was
temperature.
I was going to react to the fact that sometimes when you get to take chilled water, people say
I do that all the time.
Okay.
Specifically this period, I do take lots of cold water.
Lots of cold water. I mean, if you have access to it, fine. But don't feel that you need to go and get cold refrigerated water because no, I didn't mention that. I said just drink water. So whether it is room temperature, you know, the one that has been down, water has a cooling effect, whether cool or cold or room temperature.
But still on the water, sorry Kelly, still on the water, you know, let's talk about this night showers because lots of people tend to want to take their bath, you know, sometimes 2-3 times before dawn because of the weather. Some people, I don't know if it's superstitions or just the mere myths, they say that it is really not so advisable to have several baths before dawn. How true is that? Just break some of those myths for us.
You know, sometimes our people come up with all kinds of things that you never really know why or what the basis is. What I'll tell you is that we actually advise that you take as many baths as you possibly can because you see, we advise you to drink water. It cools you from the inside. Then you take a bath, a cool bath, even if it's with just ordinary water. That will cool you from the outside. So you can, if you feel like you're very hot in the middle of the night or even in the middle of the day, you know, in the afternoon, you're home, you have access to a shower, you don't have to be a full bucket of water or a long shower. Just getting some water. You know, sometimes some people, I've seen men in the middle of the day get some water and pour it on their head.
I'm guilty as charged.
You know, sometimes I'm so jealous. No. I think it's great. Sometimes I'm jealous of men's ability to do that because as I am like this, I can't think of pouring water on my face, on my head during the day. Okay. But it's a great way to cool down because that's what they're doing. They're cooling their bodies down.
I hope you've learned.
Yeah. Come on. Because actually, in fact, I saw a picture which was went viral of how to handle the heat. I mean, a man had this a bag of water or a bucket of water, and then he had like a pump. So it was.
No, Lagos State government, through the Ministry of Information, is actually putting out posters and handbills for telling people how to deal with the heat wave.
Okay,
And all this information is on there.
Now, there's a saying that humans are reservoirs of many diseases. For instance, I may think I'm healthy. I may walk into the hospital to probably carry out a monthly checkup, and then the doctor goes, you have this, you have this, you have this. We're in an area where they say, don't eat this, don't drink this, don't eat this. Now, what would you say to Nigerians who just, right now, they're like, I am even tired. What do we even do, self?
I know we get a lot of messages every day, and I think with the advent of social media and WhatsApp and Facebook, we see a lot of information, and sometimes you're not even sure whether the information you're getting is correct about the source. What I would just tell people is always watch the source of the information that you're getting. For example, the government is not going to put out any information that has not been verified. You get your trusted sources, the newspapers, stations like this, where you're not going to come on Galaxy Television, for example, and hear some kind of funny myths. It's going to have been verified and fact-checked. So it's important for you to look at the source of the information, and then it has to be corroborated. Sometimes you get all these outlandish forwards, videos of all kinds of things, all kinds of write-ups on things, but you have to, where God has given us a sense of discernment, you have to be able to discern. Don't believe everything you read. Don't believe everything you watch. Make sure it comes from a verified, reliable, and trusted source.
Okay, we have a comment here from Shinwo Fang. He wrote us early, and he did that again. From Ondo State, he says it is also good to go for checkups more often at the hospital, as well as get medical advice from the doctors. As Nigerians, we don't have to wait to be critically ill before we do what is right. Okay, I still want you to just hammer on that a bit. Regular checkups, how regular is regular?
Well, we actually push for a lot of routine health screenings for communicable and non-communicable diseases. Things like as you're getting older, you're hitting your 30s, your 40s, we ask you to start screening for things like hypertension, for diabetes, for cancer. With women, cervical cancer, breast cancer. Do your monthly self-breast exams for the women. The men, for prostate cancer. Because prevention is better than cure. Prevention is better than cure. I always repeat that. And that's because it is easier if you can prevent a disease. And even if you then find out that you do have the disease, if you treat it early on, your chances for full recovery are much higher than when it has been in your system for a long time, then it becomes a chronic illness. So I definitely agree, and we definitely push for routine screenings. We do a biannual MNCH week, which is just trying to help with screenings for the general public. We have primary health centers spread all across the state, about 300 primary health centers. There's one in every neighborhood. Okay. You just need to find out which the closest one to you is. We have 26 secondary health facilities. We have one tertiary health facility. The secondary health facilities are general hospitals. The tertiary health facility is Lagos State University Teaching Hospital in Ikeja. So you have a variety. You have access. And the theme for the World Health Day, which was on April 7th, was universal health coverage for everyone, everywhere. And that's what Lagos State government is trying to push, even with the Lagos State health insurance scheme, where we're trying to make sure that every single Lagos State resident, not just Lagos State indigent, as long as you're a resident of Lagos State and you have a LASRA number, then you have access to healthcare. So you just go and you register, and once you register with the Lagos State health insurance, for the Lagos State health insurance scheme, you'll be covered, and then you just pay a monthly premium. Families of up to 6 or 8 can be covered. There are also individual plans for people as well, and it's very, very affordable.
All right, we'll rest this discussion at that. But let the conversation still flow on social media. Remember the hashtag is Galaxy today. Well, also a very big thank you to our guest here in Lagos. She is a Senior Health Education Officer, Lagos State Ministry of Health. Yesterday, Olayin Kagbola, with just one O.
Well done. Well done. Thank you.
All right. We also had the Chief Nursing Officer from the University College Hospital, Ibadan, Oyeronke Bello. From Ekiti, who did we have? I'm Kelly.
Yeah, from Ekiti, we had the Senior Registrar, O&G, Federal Teaching Hospital, Dr. Ayorin. Many thanks indeed for speaking with us. And of course, that's our package. We cannot overemphasize the fact that we need to build on our personal hygiene. We need to take washing of our hands before and after eating seriously. I'm Kelly Egiga.
And I'm Justin Academy. Many thanks for hanging out with us. We'll return again tomorrow, 10 a.m. with the Lifestyle Edition. Bye for now.